healthy. Today we're going to be talking about sexual transmitted diseases. Now, I know we've talked about HIV and others, but it's not only HIV/AIDS is a sexual transmitted disease. There's so many more others that we tend to ignore or sweep under the bed, but yet they're dangerous to our lives. And in the studio, our friend here at Vision Group, and I think you're now becoming slowly an employee of this place, Dr. Ndyanabangi. Victoria, how are you doing today?
Fine, thank you. And I'm glad to be back to discuss sexual health because I feel it is pertinent.
You're welcome. So let's actually get straight into it. When we talk, you've called it sexual health. I was calling it sexual transmitted disease, which is relatively the same. First of all, what are sexual diseases, or what is sexual health?
So sexually transmitted diseases, or what we call sexually transmitted infections, just as the name is, these are diseases or organisms that cross from one person to another through sexual contact. So there are quite a number, but I know people mainly have heard about HIV because it is what everybody sings about, but they don't know that there are so many others out there, except for those who have experienced acquiring one and have been told by a doctor that you actually have a sexually transmitted disease. Sometimes we as doctors won't even tell you, we'll tell you you have an infection, but we're not telling you you got this infection through sexual contact, and we will treat you.
Is there a difference between STDs and STIs?
No, it's the same. It's just that when it's an infection, you have the organism, but it may not have given you symptoms, so you don't feel anything. You're infected, but there is nothing to show. Whereas for disease, you're now manifesting symptoms because you have the infection.
And a UTI?
A UTI now, that is when you have an infection in your urinary tract system. Now, for sexually transmitted diseases, they commonly affect the reproductive system. Yes.
Okay, because I hear these words a lot. I have an STI, you have a UTI, and then you have an STD. So we know at least the difference between the three. Let's talk about the STDs, which are the sexual transmitted diseases. You could name some of them so that we learn about them one by one. The most common one.
Yes. So the common ones are 8, and usually we categorize them into 2 broad categories. The ones that we know can be cured and the ones that are incurable. So incurable means you continue carrying them even though they may not cause you symptoms, like I said. So the ones that are curable are things like gonorrhea. I know many people know about gonorrhea. People have heard about syphilis. Then we have another one called trichomoniasis. It's a long term, but that is the name. I don't know if there's a Luganda version. It's usually that one. Many people relate if there is a local terminology, but for trichomoniasis, I don't know if there is a Luganda terminology or something like that. Then we have what we call chlamydia, which causes infection in our reproductive system, but can also cause infection in our eyes.
So what is the difference in those ones that you've mentioned, the 4?
Those are the curable ones, the ones that we treat. Then the incurable are things like HIV. I know people have heard about hepatitis B. We have what we call HSV, which is herpes simplex virus. And then we have what's the fourth? Anyway, for herpes, there is the one that affects down the vaginal system, but there is also oral herpes labialis. I know many people sometimes get it and they think it's musuja. But yes, but it's not musuja. So there's HIV, hepatitis B, human papilloma virus, which we discussed some time back, and then that HSV, herpes simplex virus. Those are the incurable.
Curable ones. So how, okay, like if I said one has herpes or those others that were mentioned, how do you differentiate them in the way they manifest themselves, just in case someone out there happens to see any symptom or sign? How would they manifest for you to be able to tell the difference between them?
Now, the challenge with them, as I have mentioned, most of them are actually viruses. We have some bacteria, some viruses, some fungus. Those are types of organisms. You don't need to know exactly what they look like and what have you. But they manifest almost similarly. So the best thing would be if you get maybe an abnormal discharge that's not the usual, you feel unwell, you start to get sores or ulcers in your genital area or near there, just go and they check, because it's difficult for me to know that this is classically gonorrhea. For instance, gonorrhea in women might not show any symptom. They have the infection, but they show absolutely no symptom. But for men, when they have gonorrhea, they're going to get a pus discharge coming, especially when they go to pass urine, they'll see something like pus come out. So they vary, and that's why we say STDs, STIs are the same family. So just go, if there's anything abnormal, go and screen. And if your partner has anything that's abnormal about either their discharge or they have ulcers or they feel pain when they are passing urine, then go and have yourself checked.
Okay. I know the most common ones that I've come across, like the ones you mentioned, gonorrhea, syphilis, and sorry, I want to a little bit focus on these ones here, because, of course, for HIV, it is, yes, they have their signs and symptoms, but eventually when you check, but these other ones tend to have visible features that you can see. And what are some of those features that, when someone just, like you said, pass, but what are some of those other features that when someone experiences them, they should be worried?
So besides what I've already mentioned, for those who get syphilis, they may get a sore. For the men or the women, we call it a syphilitic chancre. So you have a wound or a sore on your private parts. And then also, depending on the stage of syphilis, some people show some manifestations on their skin. They could be dark patches, it could be peeling skin. So something that has not been there, and you realize suddenly I have dark patches either at the soles of the feet. Commonly, that's where we look, because that's usually the brightest part. So that's where we see them. But you may have vague symptoms like fatigue. You just feel unwell, you have no appetite. But I mentioned things, of course, like a funny discharge that maybe it smells bad or looks abnormal. It's not the usual. For women, it should be either straw colored, and then you see now it is turning to yellow. It has a foul smell. So then you start to think something here is not right. Or when you go to pass urine, it's painful. The urine doesn't look the normal color that it should, either straw colored or yellow. It's now tending to deep yellow, or it's looking like there is something in it, what we call turbid. So those are some of the symptoms.
Is Sabit the one that looks like spoiled milk or something like that?
Not entirely. Now, spoiled milk is another infection, which we call candidiasis. But that one is usually not sexually transmitted. Wouldn't categorize it under sexually transmitted.
Yes, okay. So how long do these signs take to manifest after they've had an encounter, a sexual encounter?
Now, for things like gonorrhea for men, the symptoms might show maybe within a space of about 1 to 2 weeks. But for women, like I told you, most women do not have any symptom that will show when they have an infection. So it is only through screening that we'll be able to identify, especially if a male partner comes and then we say, no, bring all the other women that you have been regularly having sexual contact with for screening. So it's just about being sensitive and knowing what your normal is, and when you find something abnormal, you have it checked. Because even syphilis, the symptoms that I mentioned, like the skin changes and the chancre, by the time they come, you have had the infection for some good time. So we wouldn't want to wait till that long. We would prefer to get it early. So if you have a partner and you are suspicious, for instance, that there may be some promiscuity or infidelity, and you start to get some of these signs, just go and have yourself checked.
Okay. So if you say it starts to manifest in 2 weeks, that's quite early compared to HIV. But again, HIV then gets into AIDS and then or advances in something. how about these others, the gonorrheas and syphilis? At what stage are there different stages? Say if someone discovered they have a sore, or you said like a wound, that could be probably in early stages. But what are there other stages, and how worse does it get to someone?
So the challenges that we see with untreated sexually transmitted diseases, like I said, for them they show up in a short span compared to HIV. HIV, you can live with it even for 10 years, and you won't know actually that you have HIV if you've not done a test, because you won't show any signs. You'll just be moving around with it. But with these ones like gonorrhea, it will show. When they are not treated, the challenge is they cause fertility problems. So you're harboring an infection, and of course it's going on, and then pus maybe is forming somewhere in your body system, in your pelvis, what you call your pelvis, where the reproductive system sits. And then you form adhesions, and then for us women have fallopian tubes where the egg is supposed to pass to get into the uterus so that it's fertilized. If you have those adhesions or that scarring, then you have challenges having children. Same thing for the men. They'll get things like what we call strictures, those scars within their urethra. So you find they are having challenges, either passing urine, challenges during sexual contact, and the only thing that can be done is to actually break down those scar tissues. Then for syphilis, it can go as far as affecting your nervous system. So we don't want to wait until we get to those stages. And for women, we can actually pass them on during childbirth or during pregnancy to babies, and then they would get complications. There are chances that they could get complications. They might not, but they might. So it's a 50-50 chance. So it is treatable. The good thing is they are treatable. That's why we are saying screening is important. And if you suspect that you could have the infection, just go and they do a test, because the tests range from simple things as blood tests, checking your urine. We have rapid tests where in 15 to 20 minutes we can tell you whether you have syphilis. We can look under the microscope and tell you have gonorrhea, which is a test done on the slide. I mean, HIV we can tell you, hepatitis B we can tell you through a simple blood test. So the tests are actually there. Although for some of the infections like herpes simplex virus, the tests are not readily available in countries. So the people who are currently benefiting are people maybe who are in a study that is looking at it.
Okay, interesting to learn about that. But is there a chance, just like HIV or AIDS can be transmitted not only through sex, but is it the same for the other STDs? Is there a chance that one can actually contract it in any other way apart from sexual transmission?
No, they are strictly sexually transmitted. So it's only HIV and maybe hepatitis B, because if you have a high viral load, these other body fluids, and somebody is exposed to the other body fluids, they can actually contract it. But for the rest, it's sexually transmitted.
Okay, let's talk about hepatitis B. It's one that has been we've also heard about a couple of times. How is it contracted, and how severe can it be? I don't know if we've had so many cases in Uganda, but you would give us the numbers. But how severe can it be?
Now, hepatitis B can be actually so bad to the extent that you can either get what you call liver cirrhosis or actually even liver cancer. So that's how bad it can get. And like I said, we now have vaccination for babies, even adults. So, yes, so that has helped to reduce the numbers. I don't have the exact statistics offhand, but it has helped to reduce the numbers of people who have hepatitis B. But like I said, if somebody is affected and they don't know, and they have a huge amount of the virus in blood, any of their body fluids, like for instance, if they have if they fall sick and they are vomiting that fluid and you come into contact with it without protecting yourself, maybe wearing gloves, coming into contact with blood, if you're somebody who has sexual contact with them, if you are exposed to you're sleeping with them and they are unwell, chances are that you will pick it. So it is actually bad because it affects the liver, and getting a liver transplant is not something that's easy. Once you get liver cirrhosis, your next best option is a liver transplant. Yes, and yet it is treatable because we have antiviral drugs for hepatitis B and herpes simplex. We can treat them to reduce the virus. Like I said, it's not curable, but we can reduce the amount of virus using antiviral drugs, which are readily available in country. So if we can detect that you have it early, it would be beneficial. So those who are not vaccinated for hepatitis B should ensure they get vaccinated, because it usually takes a while for people to know that they actually have hepatitis
But
B.
the other STDs also have vaccinations for them?
It is
Not
still work in
sickness.
progress. For the viruses, they are trying to actually find vaccines for them, but it's still work in progress.
Okay. And you mentioned them being treatable, but what effects do those ones that are treatable have even when someone has actually cured? Do they have any other effect, an after effect to a person who has been a victim?
Now, I mentioned things like fertility challenges. You get these infections, and many young girls actually have engaged in sex early, and they tell them you have a pelvic inflammatory disease, but they haven't gone ahead to find out which organism has caused this pelvic inflammatory disease, and it's one of these sexually transmitted infections. Then you have issues in future because of scarring. Like I mentioned, you can't have children, so that's a fertility issue. Then we are looking,
men and men.
yes.
Okay.
Then we're talking about cancers. I've mentioned liver cancer. If you've had human papilloma virus, you could get cervical cancer. And then there are, unfortunately, these people who practice anal sex, they can also get anal cancer. So there are risks of getting certain cancers. We know that HIV also predisposes us to certain cancers. So there are fertility issues, the risks of getting cancers, the risks of having children who have deformities because they've been exposed to some of these infections, the risk of losing babies because some have died within the first month of life, or they are too small for gestational age because they were exposed to these infections while they were still in the uterus. So there are actually things that can happen. All babies are born with deformities because the mothers had syphilis. So let us not take these things for granted. Syphilis, herpes simplex, all these can actually either affect you, affect your partner, or affect your unborn baby.
Doctor, last week, actually this week, in the New Vision, we had a report that health workers had come out to say that people are actually getting infections out of oral sex, because you mentioned anal sex, and I remember that there's also that bit. Is there a chance that some of these STIs are now there's just a different infection, which comes through oral sex?
True. For instance, human papilloma virus can actually go to your throat and cause throat cancer. And that means it can cause cancer depending on where the virus decides to sit. It can cause cancer to that particular organ. So I think people need to be aware that oral sex is not entirely safe. You stand that risk. So 30, 40 years down the road, should you have it because you had human papilloma virus, which was dormant there, it shouldn't surprise you if you had ever had a history of having had oral sex.
Tough one. So for those of you who have been hiding behind that, I think if you get a copy of that New Vision and read it and what the doctor has said, it hit people hard a little bit different, especially when they're coming to their good days, which they just celebrated recently here. Okay, so let's talk about the prevention of these STDs and STIs. How do we curb the spread of these STIs?
So, when I mentioned things like vaccines, for the vaccines that are available, please go and have them. Hepatitis B is readily available. For the young girls who are between 10 to 14, human papillomavirus vaccine is actually available, so they can have that. Then screening, regular screening, like I said, if you have any abnormality, for instance, in the discharge that you normally have, be suspicious and go and have it checked. And when you are diagnosed, ensure that your partner gets to know. There's a lot of stigma. People think that, oh, when I have an STI, I can't tell my partner. It means I've been, sleeping around. Yes. So tell your partner, because otherwise the infection is going to stay both for you and for them, because when you get treated and they remain with it and they are carrying it, they're going to bring it back to you. So how many times will you be treated? So disclose to your partner that, you know what, I have this infection, and let them also get treated. That is very important. Then do regular screening checks. We now have a dual kit that actually checks for HIV and syphilis, but we've been using it for the mothers who come for antenatal.
Really?
Yes. So it can tell you at one go whether you have both, whether you have one, and then you will be treated. So those kits are actually available. HIV test kits are available. Within 20 minutes, you can have a diagnosis. We even now have the oral kits, but please get the oral kits from a facility that is going to train you how to do the self-test for HIV using the oral test kit. Then, besides that, being faithful to one's sexual partner. And lastly, one thing that people usually don't like, condoms. Barrier methods, because they protect you. If you have an infection, your partner is not bound to actually acquire it.
One more thing, I think before we leave here is the treatments. When we're talking about, yes, they're treatable, but are the treatments for these gonorrhea, syphilises, and the others that are treatable, like you said, are they available? How long do they take? What kind of technology is available to treat them?
So actually, for some of them, let me say, for instance, syphilis, there are tablets and injectables readily available and cheap that can be used. Gonorrhea, same thing. Then the other two that are the common ones that are treatable, we also use antibiotics. And by the way, most times it's a single dose and you are done. So those ones, for the treatable ones, each single dose, you take the medicine once and they are tablets. So for those ones, we actually have treatment. It's readily available. It is cheap. For the incurable ones that we said, but we want to reduce the burden, like HIV, of course, we have ARVs, which are freely given. For human papillomavirus, we don't have anything yet in particular. For HSV, which is herpes simplex virus, we have antivirals. They're a bit costly for that one. And then, what's the last one? So there are HPV. Then that one we don't have. Hepatitis B, we have drugs. We also use ARVs, but we don't use the full spectrum that we use for HIV. So those are also free and readily available.
Would you advise, I'm sorry, I've asked the last question, but this is going to be my last. Would you advise, if someone has had a history of probably gonorrhea, syphilis, and any other STD, of course, HIV we wouldn't advise, are they advised to also donate blood? Is it safe for them to donate blood for other people?
So for the incurable ones, it is not safe, but I know that Blood Bank does the screening. So every donation that happens, there is screening that is done. And if you are found to have those incurable ones, then no transfusion will be done.
But for the other ones, if you've had a history before, and
if you've had a history and you've cured, there's no problem for the
thank you so much, Doctor, for sparing that time and coming to talk to us about STDs. It's something that people, their concentration is always on HIV, and they forget about those other sexually transmittable diseases. Thank you so much. Hope that I'll see you again next time. It's because you've become one of us here. Thank you so much.